Do you know how heart pounding feels like, and what can make it worse? Well, chest pounding, feeling as if your heart were flipping or fluttering, also known as palpitations and exercise, intense emotion, standing. Anxiety can produce symptoms of heart pounding in people without heart conditions. Now, there are 5 important questions that you need to ask your patient before making a diagnosis. Firstly, you need to ask the patient about anxiety, depression, giddiness, weakness, tingling in hands or around mouth, fever, chills, chest pain, trouble breathing, loss of consciousness, pulse rate during palpitations, results of previous heart monitoring, and the rhythm of heartbeats during palpitations. Secondly, you should know the family history of patients such as heart disease, diabetes, high blood pressure, thyroid disease, and alcoholism. Ask the patient how long each episode of heart palpitations lasts, if each episode begins and ends gradually or abruptly, and if your patient has experienced palpitations before. Ask your patient if he smokes cigarettes or drink alcohol, and how much caffeine he drinks. Now, one more important question you need to ask is about his medication history. If your patient is taking any medications such as antidepressants, digitalis or other heart pills, bronchodilators or decongestants, thyroid medications. Well, this is because this particular condition might be the result of adverse drug reaction to any of these drugs. Now that you are well aware of the symptoms of your patient, your main role starts here, because you have to examine the patient. Well, this physical examination includes temperature, blood pressure, pulse, neck exam, listening to chest and heart with a stethoscope. Now, what can cause heart palpitations and what is typical for each cause? Well, there are 6 different causes of heart pounding that you should be clear about. Anxiety or depression, drug use, cardiac dysfunction, anemia, thyroid disease. I'll be explaining these terms in a while. Now, if the patient shows symptoms like numbness in both hands, faintness, pins and needles around lips, trouble breathing, occurs in people concerned about their heart health, can be a panic attack. Then, this might give you an indication that patient has anxiety or depression. Anxiety and depression are chronic feelings of a low mood or anxiety. One of the causes of heart palpitations is the use of drugs such as thyroid medications, digitalis, antidepressants, and after drinking tea or coffee. Moving to another cause of heart palpitations, if the patient shows the symptoms such as fever, chills, which is in fact fever, it's an elevated body temperature. Another cause of heart pounding is cardiac dysfunction, occurs in people with a history of angina, heart attack, or congestive heart failure. It's an abnormal function of the heart because of heart disease. If patients show the symptoms such as inability to tolerate heat, weight loss, tremor, then this might give you an indication that patient has thyroid disease. Well, it's an abnormality in the thyroid. Moving to the last cause of heart pounding, if your patient shows symptoms such as pallor, faintness, may occur after light exercise or standing suddenly, then this might give you an indication that patient has anemia. Do you know what anemia is? Well, it's low blood count. So now, if you are clear about your findings, you can manage your patient accordingly or do further investigations if required. That was all about the differential diagnosis of heart pounding. Stay tuned to sqadia.com for more such precise and knowledge-stuffed videos.